Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Tuesday, December 20, 2022, and I want to thank you so much for joining our Facebook Live. You can see that I have an esteemed guest with me today who is no stranger to these Facebook conversations. This is the CEO of Chicago Public Schools, Mr. Pedro Martinez, who is a very busy man, and yet, has taken the time, because as we do this week after week, we have been getting a lot of questions from parents, from family members who are rightly worried about their children. When we are seeing some record-breaking numbers of respiratory infections right now, obviously we're really committed to keeping kids in school. We've seen that's best, but wanted to really bring in the leader and the expert himself to talk about a lot of what CPS has been and is doing. I will just say we've been working incredibly closely throughout COVID. CPS and CDPH have always worked together, but during COVID, it has been a regular meeting, and the two of us touch base, our teams touch base, and it's not all about COVID, it's about a lot of other things. So just as a reminder, you can put your questions for either myself or CEO Martinez into the box below. You can also use the hashtag AskDrArwady. We'll go over some data. You've also brought some slides about CPS, and then in the second half or so, we'll turn to taking your questions directly. So do you want to just start off anything high level, just in terms of introduction, and then we'll dive in?
Well, first of all, thank you for having me, Dr. Arwady. And as you said, we work so closely on this because there is no other higher priority than the safety of our children. And I really just appreciate how families have embraced all of our safety procedures this year. We're just seeing a very different feeling in our schools, very positive. You're seeing more events. We've seen more musicals and plays as we're finishing the semester. And so for us, we just want to continue that momentum. And the number one concern we have is we are seeing, and you'll see our data, more cases rising. And we see more students being absent. Not all COVID, some of it just respiratory illnesses. And so we just want to make sure parents have the information, because I myself have experienced it as a parent myself. I have a 12-year-old and an 8-year-old in our schools. My daughter was sick in September. My son also got sick. I understand how scary it is for families. And so please, we want to provide you valuable information today. And again, Dr. Arwady, we just want to thank you for the partnership. We talk on a regular basis, and our staff talk on a regular, if not daily, it almost feels like daily. So just know, parents, that we are working together to make sure we keep your children safe.
Absolutely. So let's go ahead and dive in. As always, we'll start with our local COVID data. If you go to chi.gov/COVID-, every single Monday through Friday, we continue to update this. And if you take a look, you'll see that our laboratory confirmed cases, we're averaging over 600 cases every day that are being diagnosed in Chicago in the laboratory. So this does not include the hundreds or thousands that are being diagnosed through home tests. These are largely people who are sick enough to go into an emergency department, into a doctor's office, be at a laboratory. And so that is certainly up since Thanksgiving. We are seeing more than 40 Chicagoans newly being hospitalized with COVID every day. I want to emphasize that. More than 40 Chicagoans every day newly being hospitalized just with COVID. We are still averaging, though, less than 1 death a day, and I love that. When you compare it to where we were, more than 50 a day back in those terrible days of 2020, but it's not gone. We're doing more than 3,000 vaccinations every day for COVID. We're seeing a little less than 3% of our emergency room visits and a little more than 5% of our hospital beds being taken up by COVID patients. So about 1 in 20 of our hospital beds across the system right now has a patient with COVID, and that, of course, remains the number that I am the most concerned about that we're watching. If you go into the focus mode, if you click there, you can see this is a pretty sharp increase. It's nowhere near where we were. If you look, we got as high as almost 25%, 1 in 4 beds occupied with a COVID patient last December, January during the Omicron surge. But the incline here is what I have concern about. So I'm going to turn to some slide data, which we'll go through relatively quickly. We will post these online so you can go back and take a look. But I want to emphasize that this year, more than ever, this is not all just COVID. Influenza, we're having a record-breaking year for this point in the year. It's very unusual for us to be seeing as much flu here in Chicago, in Illinois, across the U.S. In December. Usually we think of flu more as something that's peaking in January, February. So you can see nearly the whole country is at that red or purple high or very high level. Here in Chicago, most of the city is at our highest level in terms of influenza-like illness. We do see a little less of it in parts of the city that have higher flu vaccination rates. And I just want to emphasize it's not too late to get your flu vaccine. It's not too late to get your COVID booster. And flu is very much here and very much on the way up. Also, given that we have a focus on schools today, here's what's happening with child hospitalizations. We really hit a crisis point already about 2 weeks ago where our hospitals, our pediatric hospitals, Lurie, University of Chicago, some of the other pediatric beds were almost 100% full. And a lot of that was from this RSV, respiratory syncytial virus. On this graph here, the blue line shows you what's happening with child respiratory admissions. So whether it's RSV or flu or COVID, and you can see that thankfully has come down a bit, but that blue level is still higher basically than it's been at any point in the last couple of years. So the good news is on the red line, the RSV is on the way down, but the purple, influenza, is up, and then COVID is up as well. And where we look at emergency department visits, in Chicago, you see it is children that are driving those emergency department visits. The highest rate is in kids 0 to 4, followed by 5 to 17, both with an influenza-like illness, which means symptoms that are likely flu, but we don't have a positive test yet, and then similarly with COVID-like illness. So kids need to be getting those vaccines and thinking about, if kids are sick, keeping them home, especially if they have a fever. Masks help, not just for COVID, but for influenza and these other viruses. We remain at a medium COVID level as a city and as a county. Just as a reminder, the CDC calculates this weekly, and the two numbers we're watching the most are the case numbers. The goal is to stay under 200, and as of late last week, at the Cook County level, we were at 163 per 100,000 population and increasing fairly quickly. And then our admissions, meaning staying overnight in the hospital per populations, that is already over the 10 mark. And so I do think it is likely that in the next short amount of time here, we probably will move to a high COVID level. And last week, 9% of counties did report high COVID levels. Many of those are large cities where we have density, we have good testing. So New York City, Los Angeles, both have moved into that high level. About 35% of counties are at a medium level, which as you can see, Chicago and Cook are at a medium level. And should and when we reach a high COVID community level, we would issue a formal mask advisory. Put your mask on indoors. I know a lot of people are wearing masks, but not that consistently. I put one on every time I'm on the L, but if and when we move to high, expect that you will be seeing signs. We really want folks, while we are on the uptick, wearing masks, especially indoors. So more to come on that. I know a lot of you follow the variants really closely. Good news, everything is still Omicron. That's the most important thing. And yes, we are watching the big surge of COVID infections in China. I have some concerns about that if folks have questions. But you can see that every week we are seeing more of these sub-variants, but it is all still Omicron, meaning the updated vaccine is a good match. And as long as it's all still Omicron, I feel confident that we are not intending to go back to the world of 2020 with closing schools, with shutting down businesses, with any of that. That is nowhere near where we are. But our goal is to keep people out of the hospital, keep people from dying, while we are able to have a hopefully relatively normal holiday season. So just a reminder, some things you can do to stay safe from COVID during the 2022 holiday season. Vax up first and foremost. Not too late, get it now. Mask up, back up, open up, meaning get a little bit, open up those windows. Even just a crack can really help with some of the circulation if you do have folks gathering. Wash up and then test up. You can order free at-home COVID tests this winter, covidtest.gov. That's that federal program again. Every household can get 4. this winter, and there's lots of other availability for at-home tests if folks have questions. Just a reminder, if you do catch COVID, nothing has changed. You need to stay home a minimum of 5 days. If you're feeling better after that, you can leave your house, but you must continue to mask for days 6 through 10. So I'm not expecting any changes in that. That's what you'd use in the schools. And I do want to highlight that last week we marked the second anniversary of COVID vaccines. We have given 5.6 million COVID vaccinations. Wow. And thank you to CPS and others who have been a huge part of that. But December 15 was that anniversary. There's 2.7 million people in Chicago. So I'm pretty happy with 5.6 million COVID vaccines. And we did a press conference around that at Lurie, because it was also in the context of the news that children under 5 are now eligible for the new updated COVID boosters as well. And that's since the last time that we did a Facebook Live. So just a reminder, this is for your young child's third vaccine. If they got Moderna, they would have had 2 doses, so they can go and get that booster now. If they got 3 Pfizer doses already, they don't need to get the booster just yet. There will be more coming about that likely early in the new year. But the third COVID shot for kids under 5 should be the bivalent booster. Yeah. And then just quickly, before I hand it to you, we are concerned that the primary series vaccine uptake, especially for those youngest kids, has been really low. In the U.S., just 8% of kids under 5 have had even 1 dose of a COVID vaccine. In Chicago, we're well over that, 17% of kids under 5, and then just 10% have completed their primary series. So I'm glad we're doing better than the U.S., but this is nothing to brag about. And I just want to compare this with the fact that when parents are surveyed, almost half of parents are actually saying they're very worried or worried that their child will get seriously sick from RSV, the flu, or COVID. And I share those worries, especially for flu, which hits young kids hard. So get both of those vaccines for everybody, but for the kids under 5, for the school-age kids. Yeah. It's important to get kids vaccinated. I put a link here, and if folks have questions, the New England Journal of Medicine, which is really the best medical journal out there, published the clinical trial data for the COVID vaccines for younger children, and it found that they were very safe, that they had good immune responses similar to what older kids and adults have. The CDC has released its data where they follow up kids who have had vaccines. No deaths. I don't want to hear it. There has not been a single death associated with a child getting a COVID vaccine. There have been 4 children hospitalized. 2 were not related to the COVID vaccine, they determined. 2 are still under investigation, but not likely to be related. There have been 0 cases in the entire country of myocarditis in this youngest group. So really, this is the most safe version we've had yet, I think, for those youngest children. And I very strongly urge people to get the updated vaccine, including for your youngest kids. It's up to date against Omicron. And I put this chart in here from the Department of Labor because I think it's a little bit of a different take. And I know this is, in the same way you're seeing kids missing school, this is showing parents who are missing work due to childcare problems at the national level. And if you look at this, that red line is the highest right now it has been going all the way back to 2003, because we have so many kids right now having these respiratory viruses that they didn't have for a couple of years. So making sure your kids have had the vaccines for the things that are more preventable, that can help them have, even if it doesn't entirely protect against COVID or flu, it does help protect against the severe outcomes. It helps kids get over it faster. So again, there's more online, but COVID vaccines now available for everybody, 6 months and up, including the updated. And just a reminder, we continue to run our at-home appointments. So Chicago is really unique in this. We got called out in the national White House sort of, what are we doing for planning around COVID? And they called out Chicago's Protect at Home program because no matter who you are, if you live in the city of Chicago, we will make an appointment and bring vaccine to you. COVID vaccines, COVID boosters, as long as somebody is getting a COVID vaccine in the family, we'll also do flu shots for everybody, all the way down to the age of 6 months. So give us a call and schedule that. That number has not changed. So let's move to the CPS. I just wanted to highlight before I hand it to you, CEO Martinez. that we work on a lot of things that go far beyond COVID. This is just the tip of the iceberg. We do a lot of surveillance, which is the fancy word for monitoring public health data. We have more than 70 diseases that we actually work closely with your Office for Student Health and Wellness across the city. If we ever see something that is unusual in a school setting, in a child setting, we're comparing that with data across the city, looking to see if anything needs to be done. And we do that not just with CPS, but with private schools, parochial schools. But we do dental and oral health exams, huge programs for that. We do the vision examinations. We do a lot of co-work on adolescent sexual health, a lot of work to make sure children and their families can be connected to primary care providers, school-based health centers. And recently, we've been focusing a lot on that connection to mental health resources, just knowing that school often is the place where kids can get some of that first and earliest assessment, but if there are mental health needs that go beyond what's able to be provided in schools, CDPH really wants to make sure that those children and their families can get that care near their home in an expeditious way. So I'm going to hand it over to you to go ahead with some of the details around CPS, and then just as a reminder, we'll turn to your questions.
So again, thank you, Dr. Awadi, for inviting us. Holiday season plus cold weather equals more indoor gatherings, more chances to get COVID, flu, RSV, and other illnesses. And parents, we really want to encourage, caution over the breaks. We know that there's evidence that shows that COVID spreads are occur more rapidly outside of the school when students and staff are socializing and gathering. This means that elevated cases when students. This means that this could lead to elevated cases when we return back to school. The good news is we're in so much of a better place today than we were last year. There's fewer cases, as Dr. Awadi said, there's fewer hospitalizations and deaths. More importantly, we now have vaccines and updated boosters for everyone from 6 months and older. And we have plenty of resources for testing.
Yep.
In addition to that, if you do get COVID, we also have better treatments still available. And so for us, we're just in so much of a better place today than we were last year. Here's some of our numbers. We have administered this school year over 378,000 tests. We've actually distributed over 644,000 rapid tests. And we've also had more than 1,680 events for vaccinations, including, my children got their boosters at their school because we have mobile events still happening at our schools. We still have our clinics that can provide all these resources. So again, parents, know these resources exist. It is very different than we were last year or 2 years ago.
And that's not 1,600 kids, that's 1,600 vaccine events. So it's been great.
Yes. Thank you. Thank you for clarifying that. Here's what cases are looking like, families. When you look at where you can see the uptick as we're heading into the end of the semester. So that is a concern. We follow the city. And so when you look at weekly cases, Dr. Awadi said, we're at about 600 cases reported right now on a daily basis. By the way, and I just want to thank families because half of our cases that are reported are through our home test. Our families are great at using those home tests. I myself use them as a parent. So when my children have any symptoms, we give them a home test. We know immediately whether they're positive. And then we can take appropriate action. So please, I just continue to encourage that. But keep in mind, it's not just COVID now. We're also worried about flu and RSV. And we have rapid home tests available at every single school. So again, we want to encourage families, please, before classes end this week, we want to make sure you get your tests. So please, if you need any tests, every school has them. We have plenty of supplies. If you also want to get them on your own, you can go online to covid.gov/backtest. So again, everybody, these programs, they exist. We also have our screening programs still going on in our schools. We still have screening every single week. Families can sign up for that as well. So again, please make sure you take advantage of these resources. And if you are sick, even if you're testing negative for COVID-19, please contact your medical provider because we are seeing record numbers of flu, RSV, and other illnesses. And we have COVID-19 vaccines and boosters available for all Chicagoans 6 months and older. Please know that this is still, as Dr. White said, and I'm just going to be a broken record, we know they're safe. We know they give you the best protection. They lessen the symptoms. And more importantly for me, I want to make sure that, especially with flu, we are seeing more children being absent. Dr. White just showed you the national data, parents being out to take care of their sick children. My children got sick earlier in the year. I know it's very scary. But no, the boosters exist, the vaccines exist, including for flu. It reduces the symptoms, and it helps our children to stay in school longer. This is just some of the data that we have on our vaccine data. As you can see, almost 90% of our staff are fully vaccinated. As Dr. Arwady said, we also are beating the national average on our vaccination rates. I still would like to see these numbers to go higher. So families, please, the vaccines are available. We have them. Like I said, we have mobile events that we can do at schools. We have all of our clinics. The vaccines are fully available at all of your drugstores. You can go with your personal physician. So please, again, we just ask you to take advantage of these resources. And then let's talk a little bit about mask wearing. Again, we are still mask optional. It's very important that we will always follow the guidance of CDPH. And so for us, we want to make sure, but we are, still following, best practices. We are requiring children to be masked for 10 days whenever there's any COVID infections in a school or infection. By the way, parents, that's allowed us to minimize children being out of school. And so right now, the only children that are isolating are children that are testing positive. But even as we look at our data, we're minimizing spread across schools. So I know it could be a hassle for families, but I just want to thank you for doing it because it just keeps our children safe. As always, we will always emphasize good hand hygiene. We're making sure that all of our schools are always constantly, filled with soap and water. It's available for children to wash their hands. And again, please, families, if your child feels sick, please just let them stay home. It's an excused absence. But please, again, know that we're going to continue to prioritize the safety of our children. And then, of course, one thing that's really is great that, again, cases are rising. And so families are getting COVID, but we have treatments available. Especially, and I know I worry about, both my mom and my mother-in-law who in their 70s and 80s. So we have, many family members that are very, very, that are always going to be at higher risk, but there are treatments available. So please know that take advantage of these treatments. Make sure that it's taken within a few days of infection. Make sure, again, that if anybody in your family tests positive, please report the case. Please consult with your healthcare provider because we have these treatments now available. And with that, the last thing is, this is again our website. Please, we have plenty of information on this website. We have FAQs. And then lastly, as Dr. Arwady said, we do a lot more than just, talking about COVID and flu. We have, vision and hearing screening services for children. We have eye examinations, dental examinations. So families, we have these services available for you. You can visit cps.edu/health forms to access these services, but no, these are there for you. And what I love is that, there's no reason anymore for children not to have glasses. There's no more reason for children not to have their hearing tested and for children to have access to dental services. So no, this is a great partnership we have with CDPH. These services are available for you. And then finally, we also, beyond the things we also provide, we have 33 school-based health centers. We do everything from physical exams to immunizations. As Dr. Arwady said, we're also putting a huge focus this year on mental health. We have all of our schools partner with providers so that we do our own screenings within schools, but also we have a way to referral children. And Dr. Arwady and I continue to work on how do we continue to improve that every day. In addition, and this is not a small thing, so many of our families qualify for Medicaid and SNAP. And so we have an office that is just dedicated to working with families to make sure they're getting those services or services that you are eligible for. So please, families, know. You see the information there, 773-553-KIDS, which is 5437. So please know that we also provide that as well. So make sure that you're getting your benefits. And with that, Dr. Arwady, we're done.
All right, thank you. So while we go ahead and just transition into your questions, maybe just to get us started, I certainly have my perspective on what feels different about this year than last year, but I'm curious from your perspective at CPS, like what feels from a COVID perspective the most different, good or bad?
Yeah, so I think first of all, because these resources exist, vaccines, so many of our staff are fully vaccinated, the testing's available. What I have seen across the schools, first of all, and I say this, and this is not a small thing, I'm seeing the joy being brought back to school. So not only am I seeing it in the classroom instruction, We actually provide time for teachers to have children just share their feelings, how they're feeling that day, what concerns, because so many of our children are still going through trauma from the previous years, and we always want to start with making sure we don't forget about that. But what I'm also seeing is we're going back to events, we're going back to field trips, all the things that make school fun. And because there's so few children being actually isolated now, and we're seeing, frankly, less cases, we're seeing, very minimal spread. What I see, and I talk to students all the time, they say, it's starting to feel like what school should feel like again.
Yeah.
And so I love that, and our staff, are always going to be very concerned about, the wellness of our children. But they're feeling better as well. And I think, Dr. Arwady, they also appreciate the fact that we have this relationship with CDPH, that we know that we're always going to be there to support with whatever services or resources they need.
That's right. Yeah. I'm guessing you must get a lot of invitations to all of the schools, holiday concerts and all that. You could probably go to one every night of the week in December if you want.
So I have to be careful, Dr. Arwady, where I go, because it sends a message, right? But I just recently went to one. Franklin Elementary School, which is a wall-to-wall fine arts program. And for me, the reason I wanted to see it is that because I want to start setting a standard for fine arts across our district.
Love it.
But I got to tell you, I love just seeing the choir. They have a rock band. They have piano. They had a theater. And so, parents, and I'm looking at that to make sure that as I look at schools across our district, that everybody has access to the arts, and I want to build those programs. And so that was just an opportunity for me to see, what does it look like when it's wall-to-wall? And so it was a great experience. But we have events across all of our schools.
Yeah.
We have posadas. We have, holiday events that are still finishing. And so again, for us, I just love the fact that joy is coming back to school.
Right.
And we're still doing it in a very safe way.
Yeah, I think, my nieces and nephews love music. My mom used to be a music teacher, and that was one thing that just really didn't work well remotely, right? But now watching my nephew learning his violin and the other one doing the recorder and some of this, like it's some of those things that let you have that focus, sort of bring some of that, I think, to education.
Absolutely.
I do think it's one of the biggest things. All right, let's dive into questions, because there's a good number. We are going to prioritize questions that have something to do with schools, but we can, work in a few of the COVID-specific ones, as needed. Okay, let's start with Kristen Lambert from Twitter. Kirsten asks, should and will CDPH mandate masking at all CPS schools after winter break to avoid the outbreak that happened after the 2021-22 winter break? It is a great question. So I'm going to start, actually, and then we'll answer these together, because we've been having a lot of conversations about this. So you already heard me say that if and when Chicago moves to a high COVID level, as determined by CDC, which is a mix of how many lab-confirmed positive cases are we seeing and what is the strain on the hospitals. If we move to a high level, at that point, we issue an advisory across the entire city. We don't do something separate for the schools. We basically say, if you are indoors, you should have a mask on while we are at high. Now, those of you who are paying close attention would know, now, is that a mandate? Is that something that you're going to legally be looking to enforce? It starts with an advisory that's consistent with what we've done previously. We would, I want you to know, consider an actual legal mask mandate, not at high, but if we started to really see a major strain on our hospital capacity. And that's because when you get to a certain point, and we have data on what this looks like, the hospitals lose the ability to take care of people who have nothing to do with COVID. They're not able to take care of you if you're in a car accident, if you're having a heart attack. And there's this societal need to make sure that we can maintain that capacity. The good news is we have the tools, Vax and Pax, vaccine and Paxlovid, that can very much keep folks out of the hospital. But we would, if we needed to, like last winter, if we got to a point where a huge number of our beds were being taken up by COVID patients to that point, we would, at that point, issue a short-term legal requirement that would apply to CPS just like it would apply to any other school or any other indoor setting. And that would just last a short period until our hospitals were back down to a point where they could handle, it's not, the surge doesn't have to be over, but at a point where you can handle things. So we do not have the intention to issue something separate for schools. We see that the higher risk actually is outside of schools, where people are letting their guard down, and you're gathering and having the holiday parties and doing all of this together. Schools have done a lot more, not just CPS, but our private and parochial, a lot more investment in a lot of the structural things like the ventilation systems, things like making sure there's masks available, the ability to do some more distancing, thinking about protecting more vulnerable kids, that actually make those settings less dangerous in some ways than a lot of the other settings. So we would not, as the city, issue a separate mask requirement. The state could. I don't think that would happen. I think it would be more, if we were doing it at the city level, it would also apply to CPS. So do you want to fill in kind of around the edges of that?
No, but thank you, Dr. Whitey, because that's exactly what we will always follow CDPH's guidance. The great thing that we're seeing right now, and the data is proving it out, even though we still have cases and cases are rising, because we do have those procedures in place, which again, parents, thank you for that, which is we still mask. We ask any class that has cases where children are potentially exposed, we have them mask up for 10 days. Families, that is helping us. That is supporting us to minimize any kind of spread. And so we will continue to follow those procedures. As Dr. Awadi said, if we go to high, we will heavily encourage masking at every school. Masks will always be available to you and your children at every single school, every single classroom. So that's our commitment to you. And then we'll just continue to monitor. But right now, the safety procedures that we have in place are working. And again, I'm just so grateful to our staff and parents for allowing us to put those in place.
Yeah, the masks help. They do. They're not 100%, but we know, particularly at a time of major surge, and I often say to people, you don't need to wait for a mandate to wear a mask. Right. And we do encourage, if we're at a high level, yes, when school comes back, it will not be a surprise to anybody that the very strong recommendation will be there, as it will be in all other indoor settings. But that is different than a legally enforceable mandate.
And it still gives parents that option because, again, we all have our different comfort levels. We also, some of our children are boosted, some are not. So I want to make sure we also differentiate to support families to make that decision. And again, if it escalates, count on our partner CDPH to immediately respond because that's been your track record.
Yeah, I have a whole team, for those who don't know, from very early on in COVID, like the earliest days, we put a focus on youth settings. Like I had my earliest, med directors really focused because we know that that's often where the most questions can come. We knew that it would land heavily on children, and especially once we had data nationally and locally around really encouraging being back in school, but with appropriate safety precautions. I think COVID is never going to be gone. And so I sometimes think of a mask like an umbrella. You pull it out when you need it. You don't need to wear it all the time. You don't need to wait for the government to tell you when to put it on. But it is something that can help. And I've very much been encouraging people, including my own staff, if you are not feeling well yourself, I don't really care if it's COVID, please wear a mask. Don't spread your cold germs. Don't spread your, your coughs. And already at the health department, most folks are wearing masks. And I've been pleased in Chicago overall that we've not had a lot of the fighting about masks. We know that there's been data that they help. We know that they're not 100% protective in the same way that we know vaccines help immeasurably, but they are also not 100% protective. These tools work together and people will make some different decisions. Where I see our role as the health department of making sure we're being clear, what is the risk right now, what is the recommendation, and then if we get to a point where we really are unable to handle hospitalizations, it then, I feel, is incumbent upon us to do some of that legally. I hope we never get there. And I see already there's a couple of questions about, are you talking about shutdowns? No. I never want to say never, because COVID has been surprising us for almost 3 years now.
Yes.
And my biggest concern is if we were to see a new variant emerge that the vaccines are not protective against, that is evading our testing in some way. I don't think that is likely to happen, but it remains out there as sort of the unknown concern. Barring that, we have the tools right now. And so I do not think we would be returning to shutting down businesses, shutting down schools, last year we had a short period where there was a vaccine requirement for high risk settings. That was because our hospitals were full and those hospitalizations were being driven so strongly by people who were unvaccinated. But I don't see that, given where we are, as being a tool we would use at this point. But the mask mandate, if we needed it, remains on the table. But you can help yourself and you can help others by doing that ahead of any requirement. All right, there's a couple of comments I want to read out, and then maybe we'll take some other topic questions and come back. So the People's Response Network to COVID-19 is the name of the person from Facebook, says N95s or KN95s are effective against COVID-19, flu, and RSV. Please get a bivalent booster and flu shot ASAP. Agree. So yes, but I think just emphasizing, and maybe I'll take that a little bit toward the masking, that when you have a mask on, the number one thing you're doing is helping to keep your germs to yourself, okay? And so that mask is largely for others, which is why we don't mandate the exact type of mask that has to be worn. Yeah. But we know, because it's more important to me that somebody has one on, and the higher level of protection, those masks can be less comfortable for people. So if everybody is wearing, a surgical mask, for example, you're getting the most protection from keeping your germs to yourself. But if you are interested in a higher level of protection, if you are immunocompromised, older, etc., those KN95 masks do give more protection for yourself also. And so, as we move into a higher risk level, I, for example, am more likely to put my KN95 on when I'm on the L as opposed to my surgical mask. But there is some difference between those. So, and I agree with you, obviously, on the flu shots. And then there's just another comment here from Orawale Idris on Facebook, who is saying, mask up, people, especially on public transportation, CTA buses and trains. Yeah, and I agree with you. Okay, let's take a slightly unrelated but schools question. So Frog Rothschild on Twitter, I think this is perhaps ahead of the winter storm, is asking, what are the odds your schools will be closed this Thursday, December 22nd? That is your last day, is it not? It
is. So families, just know we will be providing information no later than tomorrow morning. It could even be this evening. We are looking at what weather is hitting us. And so what we're looking at, so the good news is, and this is a reminder, for the vast majority, 99.9% of our students, they're off on Friday. We're actually working with a few providers that do have sessions on Friday because we do see Friday as a very challenging day for weather. But luckily, we don't have, the vast majority of our students won't be in session. We are also looking at updated weather advisory that we're getting for Thursday late afternoon. And so just wait. Give us a few hours. We're looking at that today. We're working with our city agencies. Just know, again, we're going to make sure we prioritize the safety of our students. But it's not in the morning on Thursday. We're seeing it later in the afternoon. And so that is just new information that we're just getting now. And we will be sending out, guidance to families, like I said, no later than tomorrow morning. And so please know. And then we do this in conjunction with the city agencies, which is great because they're making sure they're also talking to employers. They're looking at the whole city as a whole as well.
Okay. So there's a number of questions about testing in here. So I'm going to try to group a few of them together and read a number of them. So Kathy Powers, for example, on Facebook is asking, shouldn't we all test weekly because so much COVID is asymptomatic? So do you just want to remind folks a little bit of what's happening in the schools and I can add in?
Yes. So first of all, we're one of the few districts in the country, we might be the only one that's left, that is still doing screening testing that's available for any parent, any child, any staff person. So my children, for example, they get screen tested every week. My wife and I always kid, that's our test, because then we know whether, if our children are negative, then we're going to be negative. And then, of course, what I really love is that we have so many home tests. They're available to every family, for every student. And so those are being used on a regular basis. And I love those because, again, as soon as your child has symptoms, parents are using it. More than half our tests that are being reported are from home tests. But parents, both are available today.
And really, CPS is one of the few places in the city, in the country, that ongoing asymptomatic testing remains available. It's another layer of protection that is in the schools, and we follow all of that data, in the same way that we follow the reported data. You can sign up for weekly testing if you go to color.com/readycheckgo CPS. So, or if you go to the CPS website, I'm sure there's a link on there.
That's right.
But just a reminder, that does remain free for those who are interested in
every school.
Every school who are interested in having that sort of ongoing testing at school, and that's pretty unusual that is still available. And it's been a big use of resources, but I think it has brought an added level of comfort to folks who have concern, and it lets us identify. But I agree with you, by the way, that the home tests are where it is at for most of the population. I see Kathy also had a question here. What do you do if there's insufficient testing chemical in the home tests? And she says it happened to her 3 times. I want to emphasize that if you have COVID and your test is negative on the home test, it's not so much about the test or the chemical in the test. It has more to do with where you are in your infection cycle. So like when you're initially infected, it can take some time for that level of virus to get up to a high enough level in your body for it to show up on a home test. So that's why we say to people, and actually when I had COVID, it was when I had gone on vacation and traveled. That's like the traditional thing that happens. But I got back and I had taken a test just because I was back from traveling. And then I started not feeling well. And I took a test. It was negative, but I said, I'm going to stay home. I'm going to work from home tomorrow just because I wasn't feeling well. I'd recently traveled, the same, if you've recently had an exposure. And then by the next day, my test was positive. So it's not that the test itself isn't good. The more vaccinated you are, if you're up to date, in some ways, the less likely you are to actually mount as much of a high viral response. And, we can talk more about that immunity. But the good news is, nothing is 100%, right? Those tests are not 100%. And that's part of why we say, if you're having a fever, if you're really sick, stay home. You do that for influenza. You do that if for one of the respiratory viruses. But one of the reasons we're very interested for flu and COVID is that for both of those, there's testing available. There isn't the home testing for influenza just yet, although it might be coming in the future. But your doctor, for example, can give you a test if there's a need to know if it's influenza. The reason we care if it's influenza or COVID is partly to prevent spread, but also because there are vaccines and there are treatments. There's the Paxlovid, which you have to take in the first 5 days of symptoms. But if you are at increased risk for severe outcomes, if you are over 50, if you have underlying conditions, if you get COVID, regardless of whether you have been vaccinated or not, you can take Paxlovid and it really cuts your risk of admission. On the flu side, the same thing. If you have flu in those first few days and you have underlying conditions, you can take oseltamivir or Tamiflu. That also significantly cuts that risk. And those around you can make sure they're up to date with vaccine. So it is more important for people who are older and have underlying conditions to be, in touch with their doctor, seeing a provider, because it's not just about the diagnosis, it's that there are these treatments available because we want to keep you out of the hospital. And so we use home tests. I didn't use anything except a home test when I had COVID, and I have a lot of faith in them. But if you're really feeling sick, you should be home, even if the test is negative. Okay, so follow-up question, wondering how much Paxlovid is available citywide. It is widely available. You do need a prescription for it, so you need to either see your provider or there are test-to-treat pharmacies. If you Google test-to-treat across the whole country, you can put in your address and it will show you where are there pharmacies near you where the pharmacist can do the test on the spot, and if it's positive, they can check your medication list and prescribe you Paxlovid on the spot. And so there are lots and lots of those in Chicago. I showed that on Facebook, I think maybe 2 weeks ago. But your doctor is going to be your first call, but if you're having trouble, you don't have a doctor, know that there is test to treat, because you do have to take it in the first 5 days. But we have plenty of Paxlovid available, and it is still free from the federal government, as are all of the COVID vaccines. That's not true for other diseases, but for COVID, it remains true. Okay, Michelle Lynn on Facebook says, for almost 2 years, you said the kids wouldn't be affected by it. Now your early data says you know it would hit them the most. So Michelle, I'm not sure if you're asking about COVID or flu, but let me sort of just step back and make sure you have a good understanding of this. So we have always known that kids can and do get sick from COVID. We also have always known that kids can and do get sick from influenza and from RSV. Thankfully, kids are much less likely to get very seriously ill from COVID. Thank God, right? Imagine if kids were as likely to be hospitalized or die from COVID as those over 70 or 80. Like, imagine what these last few years would have been like. It's not impossible. We have children who are hospitalized. We have had a few children, even just in Chicago, who have died from COVID. So I want to emphasize it's not impossible. But thankfully, that risk for severe outcomes is much higher in those who are older. However, the other respiratory viruses, influenza especially, hits young children just as hard or harder as it hits our oldest Chicagoans. And RSV is almost exclusively a really serious disease in very young children. Adults get RSV sometimes every year. It just feels like a cold. It's the youngest children who end up typically being hospitalized. And the first time you see a virus often is when you have you can get the sickest from it. And so it's especially important. And I don't know if maybe you're referencing, I showed that emergency department data. It is the youngest kids right now in Chicago who are going to the emergency department with flu-like symptoms, COVID-like symptoms, RSV-like symptoms. That is not unexpected, and that is why it is critical that kids of all ages be up to date with all of their vaccines. But when I think about those 6-month to 5-year-olds, when they haven't had their flu vaccine and flu is on the uptick,
Scary.
It's scary. I'm worried about them from that standpoint. And so I think maybe you're just looking at those different diseases in different ways. And we do know that very young children, even if they're not that sick, thankfully, from COVID, they can definitely spread it, and that's what we've seen. Do you want to add anything just about that?
No, just like you said, and I've experienced this as a parent. I mean, my daughter got hit really hard in September, and it wasn't COVID, it was RSV, and we had to take her to the emergency room, and it was full. It was full of children. Luckily, she didn't have to be intaked, but it was just scary as a parent. So again, I just urge all families, we got to take this serious. We are seeing just an uptick in flu and RSV. And it's something, as Dr. Arwady said, that I know now as a parent that, I mean, as soon as we see symptoms, we just have to make sure that they're getting medical treatment as soon as possible.
All right. Someone is just looking for a little more on the test and treat locations. So you can find the link on our website, but also if you go to aspr.hhs.gov/test to treat, but also just Google test to treat, you will find it, or you can find it off the CDPH website. Good question. Okay, so I'm trying to decide which direction to go in terms of the next questions. Maybe let's stick to COVID because folks have been interested there. So there's a question, has research been done about family members of school children who have been hospitalized with these diseases? Is there a correlation between infection spread and schools? So this is somebody wondering about family members in schools. You maybe want to start there and then I'll chime in.
So the great news is that, we contact trace with every case that we have, and we actually work with CDPH, and it's very granular. I mean, they really look at everything, including exposures in families. What the data has shown us, first of all, is that we see usually cases coming into the schools versus the opposite. We see the highest cases and the highest spread really outside of school, whether it's holidays, when people are gathering more. And so that's what our data has consistently have shown. And I guess, Dr. Arwady, I mean, I know that, like I said, we work with your team, and we go deep into the granular, details. Again, we're going to be broken records. This is why it's so important that all family members get vaccinated. It's not enough just for the adults. It's not enough just for the children, especially because I always worry about our older grandparents and uncles and aunts and parents because, again, they're going to be more at risk.
Yeah, when I hear that somebody is sick, whether it's COVID or flu, the first question in my mind is not, do they have an underlying condition or how old? It's, are they up to date with their vaccines? Because if they're up to date with their vaccines, my level of worry goes way down. But if they're not, then it's about what are the underlying conditions. And I'll just remind you, we didn't know a lot of detail about how COVID was spread and what those risk factors were at the beginning. I'm sure a lot of you remember that well. But I think one of the most important studies, which was just sort of a natural experiment that happened here in Chicago, that we did is we worked really closely, not just with Chicago Public Schools, but with the Archdiocese of Chicago, which is actually the largest parochial school system in the country. So not only you're the third largest, is that right? Third or fourth? Yeah, largest public school system. We also have the largest parochial school system. And there were the CPS did not come back in person, and Archdiocese did come back in person at a time where there was a lot of debate about that. And we had this basically natural experiment then, where there were thousands of children who were in school that you could match to the thousands of children that were not in school and doing the virtual learning. And what we saw is there was not an increased risk of infection for either students or staff for being in person. In fact, we saw that the rates of infection were slightly lower in the students and staff sort of in the Archdiocese setting, partly because at that point, we'd already had COVID for a while, and people were getting together in a lot of cases anyway. They were in daycare settings or shared settings and were socializing in other ways. And that data locally here was very much reflected around the country. And it was really looking at that data that made us feel strongly about making sure we could bring kids back to school, knowing that we were seeing learning loss and emotional, all of that. And so, like everything, nothing is black and white. So you can't say there is zero chance, of course, of transmission in a school setting. But I can say again that I have less concern about being in a school setting if somebody has COVID, where I know there's, good masking after an outbreak, there's contact tracing, there's asymptomatic testing, there's all of that ventilation, there's, parents who really understand and are doing the home tests. Think about that compared to going to a restaurant, right? Where you're often none of that is in place and you are sitting close to people with masks off. And that's where we really do, emphasize that staying home when you're sick, even if it means skipping the holiday party, is important. But I would say overall, we have seen less of a correlation between infection spread in schools, I think, than we expected for COVID. And there have been a few blessings of COVID, and one of them, I think, has been the relative sparing of the severe infection. But that is not a reason not to get a COVID vaccine. Joyce Rowe from Twitter is following up there. If Chicago goes to a high-level transmission, would you personally eat inside a restaurant for a holiday gathering? So if we go to a high-level transmission, I will be being extra careful. I think it would depend a little bit on who I was meeting with. I think if I was, for example, going to be gathering with folks who were older or immunocompromised, I think I might not choose at that time period necessarily to be doing that. But I can tell you, and this is sort of to take that question a little bit further, as we head into the holidays, there is a lot of gathering, and I want people to be able to do that, but do it with confidence. So I think a few things that you can do to make those gatherings safer. Number one, know if there is somebody at higher risk.
That's right.
Is everybody up to date with their vaccines? Did they get a booster in fall of 2022? If they've done that, they've done the most important thing.
Yes.
And then number two, is there somebody who's at higher risk? Is there somebody who's on chemotherapy or on a medication that lowers the immune system, or somebody who's much older, et cetera? That's going to be someone you're going to be more concerned about. And so if you're going to be getting a lot of people together, and I want you to do that, think about have the home test, just have everybody do a test in advance. That's the kind of thing that can really lower the anxiety around it and lower the risk of, inadvertently spreading COVID. And then the most important thing is just, if anybody is sick, stay home, especially if you have a fever. I know it's not fun, but there is quite a lot of spread. And so I think I would consider continuing to eat in a restaurant, depending who it was with and if I trust them. I think if we got to a point where we were talking mask mandates and I was really worried about hospital capacity, probably at a personal level, I would also back off a lot on those interactions, just because, well, if that happens,
it's citywide,
and myself and my team will be working sort of nonstop, and I won't have time to go to a restaurant, if you know what I mean. But I think also, if that happens, we're really at more of a crisis type situation. NYC Chavez from Twitter says, hospitals are full, pediatricians are booked for months, it's hard to find Tylenol or ibuprofen in the pharmacies, and you don't seem concerned at all. What will it take? Who are you there to protect? So, my own niece and nephew have been out sick this last week with a respiratory virus. And they are up to date with their COVID vaccines, with their flu vaccines, but they've been pretty sick. And I just want to sort of talk on a couple of these things. So the hospitals first are not full, thank God.
Right.
If you look at the hospital capacity, which is on our dashboard at the bottom, about 83%, at least when I looked at it yesterday, of our beds are full across hospital systems. That is okay for this point. My concern is what could be coming, where we're seeing an early and quickly growing flu season on top of a growing COVID season, on top of all of these other respiratory viruses. Pediatricians always, I want to emphasize this, always have the ability to see some children on an urgent visit. So might you be waiting longer for a routine checkup? You might be, but I'm a pediatrician. So I can tell you that there is the ability. They are working incredibly hard. Give a shout out and a thanks to your favorite pediatrician this season. But it is important, and if I always encourage people to call, right? If you call your pediatrician, the nurse or the triage, they can help. They can give advice. They can say, do you need to be seen? Should you come in? Do you need to go to an urgent care, an emergency department? But we are, at the moment, we are okay from a hospital capacity perspective. And if we are not, that is when the last thing I want to do is cry wolf. There's a lot going around, and I'm worried heading into these next few months. But right at this moment, we continue to have capacity, including in the children's hospitals. Related to the Tylenol and ibuprofen in the pharmacies, so there is still because so many people are sick across the whole country, we're seeing some issues. Like, for example, it's hard to find Tylenol suppositories for children over a certain age. You may have to check a couple places, et cetera. But the basics are there. And in terms of being able to, you are able to order things online. They've been working to keep that up strongly. So if you have Amazon or anything else, and not that I necessarily recommend that being the way, but in the same way, I encourage everybody to have, mass and COVID tests at home. I encourage people to have a thermometer at home, because it can really help when you're trying to assess how sick somebody might be. And I encourage having Tylenol or ibuprofen at home. You do not need to go out and stock up and buy a ton of this, but making sure you have that ahead of when you get sick is important. And in terms of some of the other medications, we're watching this really closely. Paxlovid is available. Tamiflu is available. We have some stockpiles should that become an issue here in Chicago that we could address it. Antibiotics for children are available. Occasionally they're having to turn capsules into suspensions because the liquid sometimes can be hard to get. So there are a little bit of challenges, to be sure, but we are monitoring all this, and I will let you know if there is something that needs significant concern. So thank you for that. And if you are trying to get check-ins done, like checkups, before the end of the year, you're trying to do insurance, it's not a good time to try to be adding on, a non-urgent kind of visit. So if that is part of that, I would encourage you for the regular check-ins to be doing that in the coming year. Okay. So we are just about at time. We didn't quite get to everything. I see Ina Miller here is asking on Facebook, is it safe to go to urgent care with so many people sick and sitting in there close to one another? If you go to urgent care, put a mask. Put a mask. He knows the answer, exactly. Wear a KN95 mask, please.
Yeah.
If you're going to urgent care, it's because you're really sick. Don't go to urgent care if you're just looking for a COVID test. Like, you can get a COVID test, order them at home ahead, make a plan a little bit around that. But if you really are not doing well, that is what urgent care is there for. And I don't want you to avoid getting medical care because you're concerned. So wear a mask, try to keep the distance. Urgent cares, emergency departments, pediatric offices are all doing what they can in terms of ventilation and spacing, et cetera. But we're just seeing a lot of respiratory viruses right now because we didn't see them for a couple of years during COVID. So that's what's happening. All of these kids are getting the respiratory viruses they didn't have for the last 2 years, sort of all at once. And so this too shall pass in the way that RSV, thankfully, is very much on the way back down. But in the meantime, some extra care and caution, especially in the holiday season, to limit some of that risk is important. All right. I think we're basically at the top of the hour, and we really kept it with an infectious disease COVID focus today. But perhaps another time in the new year we can come back and talk a little bit more about some of those other things, because we, believe it or not, we like to talk about things besides COVID and infectious diseases too. I really do have every confidence in CPS as we are heading into this winter break. It's a complicated time, knowing that this is respiratory virus season and that surge that is coming is likely to hit across the whole city, not differently in schools. And we are continuing to work closely together on that. But I think it's good news that our conversations are largely about non-COVID things, just because I am very confident in the protocols we have in place. Do you just want any sort of last comments or additional things?
Just again, parents, please exercise caution during the break. Please take home tests if you don't have them already available. All of our schools have them. We will also, as we see things during the break, if we need to inform you about a change in procedures, we will inform you. So please know that we will keep you updated. We work with Dr. White, including during the break, right, Dr. White? Our staff don't get a lot of rest. So no, we're going to continue to monitor this on your behalf. But number one, please enjoy your holidays. Do it in a safe way. Make sure that especially as we come back for the second semester, which again, we want to keep up that joy and that positive, atmosphere in the schools. If your children are sick, please keep them at home. There'll be excused absences. We will understand and we will work with you.
Yeah, thank you. And I would just ahead of the holidays, I'd like to give a shout out and a thank you to my whole team at CDPH and to the team at CPS, the health and safety team. It's been a challenging time. And both of the last holiday seasons, we didn't really have that much of a holiday. If you go back 2 years ago, December 15 is when vaccines rolled out. That was an incredibly exciting time, but it meant that my team didn't really have a break. And then last winter, we got hit with Omicron, and we were working so hard to, find places that people experiencing homelessness could be during a COVID surge, and, working on masks and testing. And that's when home tests were really becoming available. So it has been, it's been a long, almost 3 years, but the holiday seasons, I think for my own team, and I know your team as well, have been times of particular challenge. We are keeping our eye on this. I want you to know that we talk about this every day. We look at the data every day. We are not out of the woods, but we are in a very different place. And so know that if and when we move to a high level, we will be asking you to put those masks back on. And that is to help protect yourself, to help protect Chicago, and to help keep us open, keep us being able to celebrate. And, when I look at CPS, it's such a place of meeting needs of children and families, and we don't think of the health first. We think of making sure that health is there in a way that supports the education and supports that just critical role that you and your teams play. So thank you, for
Dr.
all of the
Awadi.
work, and happy holidays,
to
you. Happy holidays to everyone. Thank you for your questions. If we didn't get to them, or they weren't about COVID, we'll come back and get some of those, once we're sort of past this surge. But it's been great working together.
Thank you.
And I thank you for your continued interest. Have a really safe and happy holiday season.
Happy holidays.